Question 1. A nurse is assessing a client suspected of having a stroke. Which finding requires immediate action? A. Blood pressure 150/90 mmHg. B. Slurred speech. C. Sudden loss of vision in one eye. D. Weakness on one side of the body. Correct answer, D. Weakness on one side of the body. Rationale. Unilateral weakness is a classic early sign of stroke and indicates impaired blood flow to the brain. This requires immediate intervention to prevent permanent damage. Strategy. Focus on fast, face drooping, arm weakness, speech difficulty, time. Always prioritize new neurological deficits. Question 2. A client arrives at the emergency department with stroke symptoms that started 1 hour ago. Which medication should the nurse anticipate? A. Heparin. B. Aspirin. C. Alteplase, TPA. D. Warfarin. Correct answer, C. Alteplase, TPA. Rationale. Alteplase is a thrombolytic used within 3 to 4.5 hours of ischemic stroke onset to dissolve clots. Strategy. Think. Clot equals TPA, if early enough. Always check time of symptom onset first. Question 3. Which condition is a contraindication for giving Alteplase, TPA? A. Blood pressure 140/80 mmHg. B. Ischemic stroke. C. Recent head injury. D. Age above 65. Correct answer, C. Recent head injury. Rationale. TPA increases bleeding risk. A recent head injury raises the chance of fatal intracranial hemorrhage. Strategy. Avoid TPA if there is any bleeding risk, trauma, surgery, hemorrhage. Question 4. A nurse is caring for a client with increased intracranial pressure, ICP, after a stroke. Which position is best? A. Flat on the bed. B. Head elevated 30 degrees. C. Trendelenburg position. D. Side lying with knees bent. Correct answer, B. Head elevated 30 degrees. Rationale. Elevating the head promotes venous drainage and reduces ICP. Strategy. Think, high pressure in brain equals elevate head. Question 5. Which assessment finding indicates a worsening stroke? A. Improved speech. B. Decreasing blood pressure. C. Sudden severe headache. D. Increased appetite. Correct answer, C. Sudden severe headache. Rationale. A sudden severe headache may indicate hemorrhagic transformation or bleeding in the brain. Strategy. Red flag equals worst headache of life emergency. Question 6. A nurse is assessing swallowing ability in a stroke patient. What is the priority concern? A. Malnutrition. B. Aspiration. C. Dehydration. D. Constipation. Correct answer, B. Aspiration. Rationale. Stroke patients often have dysphagia, increasing the risk of aspiration and pneumonia. Strategy. Before feeding always check swallowing reflex. Question 7. Which intervention helps prevent aspiration in a stroke patient? A. Give fluids quickly. B. Place patient flat. C. Keep patient NPO until assessed. D. Use a straw for drinking. Correct answer, C. Keep patient NPO until assessed. Rationale. The patient must be evaluated for swallowing before oral intake. Strategy. Stroke equals NPO until swallow test. Question 8. Which side should the nurse approach a stroke patient with left-sided neglect? A. Left side. B. Right side. C. From behind. D. It doesn't matter. Correct answer, A. Left side. Rationale. Approaching from the affected side encourages awareness and stimulation. Strategy. Neglect side, engage it, don't ignore it. Question 9. A patient with a stroke has expressive aphasia. What does this mean? A. Cannot understand speech. B. Cannot speak properly. C. Cannot hear. D. Cannot read. Correct answer, B. Cannot speak properly. Rationale, expressive aphasia equals difficulty forming words, but understanding is usually intact. Strategy, expressive equals output problem. Question 10. Which is the priority nursing intervention in acute stroke? A. Give food. B. Maintain airway. C. Start physical therapy. D. Provide education. Correct answer, B. Maintain airway. Rationale. Airway, breathing, circulation, ABC, always come first. Strategy. Always ask, what will kill the patient first? Airway. Question 11. A nurse is caring for a stroke patient with right-sided weakness. Where should the nurse place the call light? A. On the right side. B. On the left side. C. Behind the patient. D. Under the pillow. Correct answer, B. On the left side. Rationale. Place items on the unaffected, strong, side. Strategy. Weak side equals avoid. Strong side equals use. Question 12. Which sign suggests a hemorrhagic stroke rather than ischemic? A. Gradual onset. B. Mild headache. C. Sudden severe headache. D. Slow progression. Correct answer, C. Sudden severe headache. Rationale. Hemorrhagic strokes often present with sudden, intense headache. Strategy. Bleeding equals dramatic symptoms. Question 13. What is the goal of antihypertensive therapy in stroke? A. Eliminate blood pressure. B. Maintain adequate cerebral perfusion. C. Cause hypotension. D. Increase heart rate. Correct answer, B. Maintain adequate cerebral perfusion. Rationale. Too low BP reduces brain perfusion, too high increases damage. Strategy. Balance equals not too high, not too low. Question 14. Which lab value must be checked before giving TPA? A. Hemoglobin. B. Platelet count. C. Sodium. D. Potassium. Correct answer, B. Platelet count. Rationale. Low platelets increase bleeding risk. Strategy. TPA equals always check bleeding risk labs. Question 15. A stroke patient suddenly becomes unconscious. What is the nurse's first action? A. Call family. B. Check airway and breathing. C. Document findings. D. Give medication. Correct answer, B. Check airway and breathing. Rationale. Immediate priority is life support, ABC. Strategy. Unconscious equals ABC's first, always. Question 16. A nurse is caring for a client receiving alteplase, TPA. Which finding should be reported immediately? A. Mild headache. B. Oozing from foresight. C. Sudden change in level of consciousness. D. Nausea. Correct answer, C. Sudden change in level of consciousness. Rationale. This may indicate intracranial bleeding, a life-threatening complication of TPA. Strategy. TPA equals monitor for bleeding in the brain. Neuro changes equals emergency. Question 17. Which assessment tool is commonly used to evaluate stroke severity? A. Glasgow Coma Scale. B. Braden Scale. C. NIH Stroke Scale. D. Morse-Fall Scale. Correct answer, C. NIH Stroke Scale. Rationale. The NIH Stroke Scale assesses neurological deficits and stroke severity. Strategy. Stroke equals think NIH scale. Question 18. A patient has right-sided paralysis after a stroke. Which brain area is most likely affected? A. Right hemisphere. B. Left hemisphere. C. Cerebellum. D. Brainstem. Correct answer, B. Left hemisphere. Rationale. Each brain hemisphere controls the opposite side of the body. Strategy. Opposite rule, left brain right body. Question 19. Which diet is appropriate for a stroke patient with dysphagia? A. Regular diet. B. Thickened liquids. C. Clear liquids only. D. High-fiber diet. Correct answer, B. Thickened liquids. Rationale. Thickened liquids reduce risk of aspiration. Strategy. Swallow problem thick, not thin. Question 20. Which action helps prevent deep vein thrombosis, DVT, in stroke patients? A. Bed rest. B. Passive range of motion exercises. C. Restrict fluids. D. Keep legs dependent. Correct answer, B. Passive range of motion exercises. Rationale. Immobility increases DVT risk, movement improves circulation. Strategy. Immobility equals move the patient, even passively. Question 21. Which symptom is associated with a left hemisphere stroke? A. Impulsive behavior. B. Poor judgment. C. Aphasia. D. Spatial neglect. Correct answer, C. Aphasia. Rationale. Left brain controls language and speech. Strategy. Left brain equals language problems. Question 22. A nurse notes a stroke patient is impulsive and has poor judgment. Which side is affected? A. Left side. B. Right side. C. Both sides. D. Brainstem. Correct answer, B. Right side. Rationale. Right hemisphere strokes affect behavior and judgment. Strategy. Right brain equals reckless behavior. Question 23. Which intervention is priority for a patient with decreased gag reflex? A. Encourage fluids. B. Give oral meds. C. Suction equipment at bedside. D. Start feeding. Correct answer, C. Suction equipment at bedside. Rationale. Decreased gag reflex increases risk of airway obstruction. Strategy. Airway risk equals prepare suction. Question 24. A stroke patient is prescribed aspirin. What is its purpose? A. Dissolve clots immediately. B. Prevent further clot formation. C. Lower blood pressure. D. Reduce pain. Correct answer, B. Prevent further clot formation. Rationale. Aspirin is an antiplatelet, preventing new clots. Strategy. Aspirin equals prevention, not emergency clot removal. Question 25. Which sign indicates improvement in a stroke patient? A. Increased confusion. B. Ability to move affected limb. C. Slurred speech worsening. D. Severe headache. Correct answer, B. Ability to move affected limb. Rationale. Return of movement shows neurological recovery. Strategy. Improvement equals function coming back. Question 26. A nurse is educating about stroke prevention. Which is the most important modifiable risk factor? A. Age. B. Hypertension. C. Gender. D. Genetics. Correct answer, B. Hypertension. Rationale. High blood pressure is the leading cause of stroke. Strategy. Stroke prevention equals control BP first. Question 27. Which finding suggests increased intracranial pressure, ICP? A. Bradycardia. B. Tachycardia. C. Hypotension. D. Increased urine output. Correct answer, A. Bradycardia. Rationale. Bradycardia is part of Cushing's triad, late sign of ICP. Strategy. ICP equals slow pulse equals danger. Question 28. Which position is best during feeding for a stroke patient? A. Flat. B. Supine. C. Upright 90 degrees. D. Trendelenburg. Correct answer, C. Upright 90 degrees. Rationale. Upright position reduces aspiration risk. Strategy. Feeding equals sit them up fully. Question 29. Which is a priority goal in stroke rehabilitation? A. Complete bed rest. B. Independence in activities. C. Isolation. D. High-calorie intake only. Correct answer, B. Independence in activities. Rationale. Rehab focuses on regaining independence. Strategy. Rehab equals function and independence. Question 30. A patient is at risk for stroke. Which lifestyle change is most important? A. Increase salt intake. B. Quit smoking. C. Sleep more. D. Avoid exercise. Correct answer, B. Quit smoking. Rationale. Smoking damages blood vessels and increases stroke risk. Strategy. Smoking equals major vascular risk. Stop it. Question 31. Which complication is most common after a stroke? A. Kidney failure. B. Pneumonia. C. Liver disease. D. Diabetes. Correct answer, B. Pneumonia. Rationale. Aspiration leads to aspiration pneumonia. Strategy. Stroke swallowing problem, lungs at risk. Question 32. A nurse is repositioning a stroke patient. How often should this be done? A. Every 8 hours. B. Every 4 hours. C. Every 2 hours. D. Once daily. Correct answer, C. Every 2 hours. Rationale. Prevents pressure ulcers and complications. Strategy. Immobile patient equals turn Q2H. Question 33. Which sign indicates brainstem stroke? A. Aphasia. B. Vision loss. C. Altered breathing pattern. D. Memory loss. Correct answer, C. Altered breathing pattern. Rationale. Brainstem controls vital functions like breathing. Strategy. Brainstem equals life functions, breathing, HR. Question 34. Which is a key early sign of stroke? A. Chest pain. B. Sudden numbness. C. Fever. D. Rash. Correct answer, B. Sudden numbness. Rationale. Sudden numbness/weakness is a classic warning sign. Strategy. Stroke equals sudden neuro change. Question 35. Which intervention helps with communication in aphasia? A. Speak loudly. B. Use simple sentences. C. Ignore patient. D. Rush responses. Correct answer, B. Use simple sentences. Rationale. Simple communication improves understanding. Strategy. Aphasia equals slow, simple, patient. Question 36. A nurse is caring for a stroke patient on bed rest. Which is the priority complication to prevent? A. Constipation. B. Pressure ulcers. C. Anxiety. D. Hair loss. Correct answer, B. Pressure ulcers. Rationale. Immobility leads to skin breakdown quickly, especially in stroke patients. Strategy. Immobility equals skin first turn patient. Question 37. Which assessment finding suggests aspiration pneumonia? A. Clear lungs. B. Dry cough. C. Fever and crackles. D. Increased appetite. Correct answer, C. Fever and crackles. Rationale. Aspiration causes infection, fever plus abnormal lung sounds. Strategy. Stroke plus cough plus fever equals suspect aspiration. Question 38. A nurse is caring for a client with a hemorrhagic stroke. Which medication is expected? A. Alteplase. B. Heparin. C. Mannitol. D. Warfarin. Correct answer, C. Mannitol. Rationale. Mannitol reduces intracranial pressure, ICP, by pulling fluid out of the brain. Strategy. Bleeding stroke equals reduced pressure, not thin blood. Question 39. Which vital sign change is most concerning in a stroke patient? A. BP 140/90. B. HR 60. C. Irregular respirations. D. Temp 37 degrees Celsius. Correct answer, C. Irregular respirations. Rationale. Irregular breathing indicates brainstem involvement. Strategy. Breathing changes equals life-threatening, act fast. Question 40. A nurse is educating a patient about stroke warning signs. Which acronym is correct? A. RACE. B. FAST. C. CARE. D. STOP. Correct answer, B. FAST. Rationale. FAST equals face drooping, arm weakness, speech difficulty, time. Strategy. Memorize FAST for exams and real life. Question 41. A stroke patient is confused and trying to get out of bed. What is the best action? A. Apply restraints immediately. B. Leave patient alone. C. Use a bed alarm. D. Ignore behavior. Correct answer, C. Use a bed alarm. Rationale. Safety comes first. Bed alarms prevent falls without restraints. Strategy. Confusion equals protect without restraining first. Question 42. Which lab value is most important in monitoring anticoagulant therapy? A. WBC. B. INR. C. Sodium. D. Glucose. Correct answer, B. INR. Rationale. INR measures blood clotting and guides anticoagulant dosing. Strategy. Blood thinners equals check INR. Question 43. Which finding indicates a transient ischemic attack, TIA? A. Permanent paralysis. B. Symptoms resolve within hours. C. Severe bleeding. D. Loss of consciousness. Correct answer, B. Symptoms resolve within hours. Rationale. TIA equals mini-stroke with temporary symptoms. Strategy. TIA equals warning sign, act fast. Question 44. Which nursing action is appropriate for a stroke patient with visual deficits? A. Place objects randomly. B. Approach from affected side only. C. Place objects on unaffected side. D. Keep room dark. Correct answer, C. Place objects on unaffected side. Rationale. Helps patient function using their strong side. Strategy. Deficit side equals avoid. Strong side equals use. Question 45. A nurse notes unequal pupils in a stroke patient. What does this indicate? A. Improvement. B. Normal finding. C. Increased ICP. D. Dehydration. Correct answer, C. Increased ICP. Rationale. Unequal pupils suggest brain pressure or herniation. Strategy. Pupil changes equals neuroemergency. Question 46. Which action is priority when giving TPA? A. Give IM injections. B. Monitor for bleeding. C. Encourage ambulation. D. Give aspirin. Correct answer, B. Monitor for bleeding. Rationale. TPA greatly increases bleeding risk. Strategy. TPA equals watch for any bleeding signs. Question 47. Which sign indicates Cushing's triad? A. Tachycardia, hypotension, fever. B. Bradycardia, hypertension, irregular respirations. C. Normal vitals. D. Low BP only. Correct answer, B. Bradycardia, hypertension, irregular respirations. Rationale. Classic late sign of increased ICP. Strategy. Cushing's equals slow pulse plus high BP plus bad breathing. Question 48. A stroke patient has difficulty understanding speech. What is this called? A. Expressive aphasia. B. Receptive aphasia. C. Dysphagia. D. Dysarthria. Correct answer, B. Receptive aphasia. Rationale. Receptive aphasia equals inability to understand language. Strategy. Receptive equals input problem. Question 49. Which intervention reduces risk of contractures? A. Bed rest. B. Splints and ROM exercises. C. Restrict movement. D. Avoid repositioning. Correct answer, B. Splints and ROM exercises. Rationale. Maintains joint flexibility and prevents deformities. Strategy. No movement equals stiffness. Move joints. Question 50. What is the ultimate goal in acute stroke management? A. Cure immediately. B. Prevent brain damage. C. Provide comfort only. D. Sedate patient. Correct answer, B. Prevent brain damage. Rationale. Early intervention aims to preserve brain tissue and function. Strategy. Stroke care equals time is brain.